Is HbA1c misleading us in India? As doctors, we depend on numbers every day. Numbers guide our diagnosis, numbers guide our treatments, numbers guide our decisions. But today, I want to ask you a very important question. What if one of our most trusted numbers is not always telling us the full truth? Today, we are talking about HbA1c, the test we rely on almost blindly in diabetes care. Let me begin with a very simple question. When you see an HbA1c value, do you completely trust it? Yes, most of us do. We see a number 6.5, 7.2, 8.4, etc. And within seconds, we make decisions that can change a person's life. But today, I want to gently challenge that confidence. Because in the Indian context, HbA1c may not always be telling us the full truth. India today has more than 100 million people living with diabetes. So, if our interpretation of HbA1c is even slightly inaccurate, we are not talking about small numbers. We are talking about millions of real patients who may be wrongly diagnosed, wrongly reassured, or wrongly treated. And that's why this topic is so important. Let's simplify HbA1c for everyone watching. Inside our blood, we have red blood cells that live for about 120 days. Glucose in the blood slowly attaches to hemoglobin in these cells. This process forms HbA1c. So, HbA1c is basically a memory of sugar exposure over the last 3 months. Sounds perfect, right? But there is a hidden assumption here that every person has normal red blood cells with normal lifespan. And in India, that assumption often does not hold true. Even in ideal situations, HbA1c is not exact. For example, two patients with the same HbA1c of 8% can have very different average glucose levels, anywhere between 155 and 218 milligram per deciliter. And when researchers studied Indian populations, they found something even more concerning. Up to 45% of diabetics detected by OGTT or oral glucose tolerance test are completely missed by HbA1c alone. So we are missing real disease and sometimes diagnosing disease that is not there. Now let's bring this closer to our real patients. In India, more than half of adults have anemia. Iron deficiency is extremely common. Many regions have hemoglobin disorders. G6PD deficiency is also present, and every one of these conditions alters red blood cells. And since HbA1c depends on red blood cells, it also gets altered. Let me make this very real. Imagine a young woman with iron deficiency anemia. Her HbA1c comes as 6.7%. She is labeled diabetic. She starts medication. She is anxious, scared, overwhelmed. But in reality, her glucose may be completely normal because iron deficiency alone can falsely raise HbA1c by up to 1%. Now imagine another patient with G6PD deficiency or hemolysis. His HbA1c comes as 5.8%. He is told everything is fine, but in reality, his glucose may be high and disease is progressing silently. Because HbA1c can be falsely low in such conditions, delaying diagnosis by more than 4 years. And the challenge does not end with biology. In a survey across India, 75% of HbA1c reports were inaccurate. Less than 10% labs were properly standardized. So, what do we do? Do we stop using HbA1c? No, HbA1c is still very useful, but it should never be used alone. For diagnosis, think of a triad: HbA1c, fasting glucose, and OGTT or oral glucose tolerance test. Because in India, OGTT remains the gold standard. For monitoring, combine HbA1c, self-monitoring of blood glucose, and continuous glucose monitoring or CGM when available. And in special situations, consider fructosamine or glycated albumin or on-5 anhydroglucitol. As clinicians, we must develop a habit. Always look at CBC or complete blood count and RDW. Always correlate with glucose readings. Always question discordance. Because medicine is not about numbers alone. It is about interpreting numbers in the context of a human being. At the end of the day, HbA1c is not wrong, but it is not complete. It is a lens through which we see glucose control. But in India, that lens can sometimes be tinted by anemia, genetics, and physiology. So our responsibility as doctors is simple. Do not accept HbA1c blindly. Do not ignore the clinical context and never forget the patient behind the number, because every HbA1c report we sign affects a real life, a real family, and a real future. So the next time you see an HbA1c value, pause, think, and interpret it wisely. Thank you.